Hello, I'm Dr. James. Today, we need to talk about a serious topic: pancreatic cancer. While this disease is often diagnosed in its later stages, I want to be very clear about one thing. Knowing the early signs can be like faltering. Awareness is a powerful tool, and this video is about empowering you with the knowledge to recognize potential warning signs, not to create fear, but to encourage proactive health management. Understanding what to look for is the critical first step towards early detection and a wider range of treatment options. Many people refer to pancreatic cancer as a silent disease, but this isn't entirely accurate. The symptoms are often subtle and can be easily mistaken for other, more common conditions. That's why it's so important to understand what they are and why they happen. Let's break down these key early signs. One of the most frequently reported signs is unexplained weight loss. This isn't just losing a few pounds after starting a new diet or exercise routine. We're talking about a significant drop in weight when you aren't trying to lose it. This happens because the cancer cells are consuming a large amount of the body's energy, diverting resources that your healthy cells need to function. This can also be accompanied by a noticeable loss of appetite. You might feel full after eating only a small amount of food, or simply lose your desire to eat altogether. It's a change that feels distinct from your normal patterns. Another critical indicator to be aware of is the new onset of diabetes, particularly in someone over the age of 50 who is otherwise healthy and doesn't have the typical risk factors like obesity or a strong family history of the disease. It can also manifest as a sudden, unexplained difficulty in managing pre-existing, long-term diabetes. The reason for this connection is that the pancreas produces insulin, the hormone that regulates blood sugar. A tumor growing in the pancreas can damage or interfere with these insulin-producing cells, leading to high blood sugar levels and the development of diabetes. If you or your doctor notice a sudden, unexpected change in your blood sugar, it warrants further investigation. Pain is another symptom, but it's often described in a specific way. It's typically a persistent, dull ache felt deep in the upper abdomen that may radiate through to the middle of your back. This pain can be intermittent at first but often becomes more constant over time. It may worsen after eating or when you are lying down. This occurs because of the tumor's location. As it grows, it can press on adjacent organs or on the complex network of nerves surrounding the pancreas, causing this characteristic discomfort. Unlike a simple muscle strain, this pain doesn't go away with rest and can be a significant sign that something is wrong internally. A very specific and often more obvious sign is jaundice. This is a yellowing of the skin and the whites of the eyes. Jaundice is a strong indicator, especially if the tumor is located in the head of the pancreas. The pancreas is situated next to the bile duct, a small tube that carries bile from the liver to the intestines. Bile helps with digestion and gives stool its normal brown color. A tumor in the head of the pancreas can compress or block this duct. When bile can't flow properly, a substance called bilirubin builds up in the blood, causing the skin and eyes to turn yellow. This is an urgent symptom that should never be ignored. Directly related to a blocked bile duct are changes in your digestive system's output. You might notice that your stools have become very light-colored, sometimes described as pale, clay-colored, or gray. This is because bilirubin, which normally colors the stool, is being blocked from entering the intestines. At the same time, because the excess bilirubin is being filtered out by the kidneys, your urine may become very dark often, appearing brown or tea-colored. The combination of light-colored stools and dark urine is a classic sign of bile duct obstruction and warrants an immediate medical evaluation. Finally, persistent nausea, vomiting, or other digestive changes can be early signs. A tumor can press on the stomach, partially blocking it or interfering with its ability to empty properly. This can lead to a constant feeling of nausea, indigestion that doesn't resolve with standard antacids, or even vomiting. While these are very common symptoms tied to many different issues, their persistence and occurrence alongside other signs on this list should raise a red flag. This brings me to a crucial point: the cluster concept. It is incredibly important to understand that any one of these symptoms, on its own, could be caused by a wide variety of less serious conditions. Unexplained weight loss could be stress-related. Back pain could be a musculoskeletal issue. Digestive upset is extremely common. However, the level of concern should increase significantly when you experience a cluster of these symptoms together, and when they are persistent. The key is to look at the whole picture. If you are experiencing new-onset diabetes, persistent abdominal pain, and unexplained weight loss all within a few months, that is a pattern that demands attention. Don't dismiss these signs individually. Consider how they are presenting as a group. We also know that certain factors place some individuals at a higher risk. This doesn't mean you will get pancreatic cancer, but it does mean that your level of vigilance should be heightened. A strong family history, meaning one or more first-degree relatives, a parent, sibling, or child who have had the disease, is a significant risk factor. Certain inherited genetic syndromes, such as mutations in the BRCA1 or BRCA2 genes, are also linked to an increased risk. Additionally, long-term chronic pancreatitis, which is persistent inflammation of the pancreas, can lead to damage that increases cancer risk over time. Other major factors include long-standing diabetes and, very importantly, smoking. Smokers are 2 to 3 times more likely to develop pancreatic cancer than non-smokers. If you fall into any of these high-risk groups, it is even more critical to be attuned to these early symptoms. So, what is the single most important step you can take if you are concerned? You must become your own best advocate. If you are experiencing a persistent cluster of the symptoms we've discussed, your first action is to document them. Keep a simple log. Write down what the symptom is, when it started, how often it occurs, and what makes it better or worse. This detailed record is invaluable when you speak with your doctor. Make an appointment with your primary care physician and be direct and clear about your concerns. It is perfectly appropriate to say, "I am concerned about the possibility of pancreatic cancer because I have been experiencing unexplained weight loss, new abdominal pain, and changes in my digestion." Be persistent. If you feel your concerns are not being fully addressed, seek a second opinion. Your health is your priority, and you have the right to be heard and to have your symptoms thoroughly investigated. In conclusion, I want to reiterate that the purpose of this information is not to cause fear or anxiety. It is to arm you with knowledge. Awareness saves lives. Pancreatic cancer is a formidable disease, but a diagnosis made at an earlier stage opens the door to the widest and most effective range of treatment options, including surgery, which offers the best chance for long-term survival. By recognizing these subtle signs, understanding the concept of a symptom cluster, and advocating for yourself, you are taking a powerful, proactive step in managing your health. Thank you for your attention.